Today is the day that I am finally switching insurances, and I figured what better opportunity to actually jump online and share the entire process with you as well, because I have been told that switching health insurance providers here in Germany is very similar to actually signing up for the very first time. But did you know that it is actually mandatory to have health insurance here in Germany? Yeah. Whether you're a student, an employee, a freelancer, or just moved to Germany for the very first time, getting covered is mandatory. It's actually quite easy, and we're actually gonna walk through this entire process step by step together today as I switch my health insurance for the very first time. And I'm gonna be honest with you, I do wish that I had have switched sooner. The reason I didn't switch sooner is because paperwork in Germany always sets me back thinking, oh no, it's gonna be a whole process, there's gonna be a lot of paperwork, it's all gonna be in German, I don't wanna go through it again. But health insurance costs in 2025 increased drastically. So not only am I gonna be saving money by switching today to Krankenkasse, which we'll call TK moving forward, but also when I first got started, I just took the easy route, which I know many of you watching this, if you have German health insurance, probably did something similar. I moved to Germany for love. My boyfriend was here. I went with the insurance company he went with. He went with them because his family went with them. They signed him up when he was a kid. You didn't really look into it. How much money am I gonna save? Do they have English support? Can I get all the information I need online in one super helpful app? We don't look at that. So today I'm stopping that train, and I am finally making this decision for myself and for some very, very good reasons, which we will jump into in just a second. I have gotten in contact with TK, and they have agreed to jump on board as a collaborator for this video to make sure that as we're going through this process, we have them supporting us, making sure that all the information I'm providing you is not only factual and correct, but up to date. So thank you, TK, for all of your support and for being the sponsor for today's video. But before we dive right in, I'm going to answer the question that many of you are probably asking yourself right now, and that is, why TK? Of course, I already told you I'm gonna be saving quite a bit of money, which is nice. But also over the last 11 years that I've been in Germany, some things with TK in particular have stood out to me very prominently. The fact that they're extremely digital, they can be a lot more flexible, they're more affordable when you're looking at the new Zusatzbeitrag or additional contributions that have increased this year for public health insurance companies. And just on a side note, so that you're aware, public health insurance costs are standardized, so you're not gonna be paying more for one or less for another. However, as mentioned, this Zusatzbeitrag or additional contribution is then set by each individual insurance provider to help them cover those rising costs of healthcare. So each one is a little bit different, but when you do the math, which I will show you the math that I did for myself closer to the end of this video, you can actually save a pretty penny. And the biggest answer to this question for me has been the fact that they are super expat friendly. I still find huge comfort and relief in having my health insurance provider offer me support in English, whether you want to admit it or not. Paperwork in the German language, even when you fluently speak German, is not easy. So, in this video today, I am going to break down, for those of you who are new, how the health insurance system works here in Germany, how to switch, and more importantly, how to sign up for those of you who are just moving to Germany, why I'm switching health insurance providers, and just how much money I will be saving moving forward. So a very quick briefing on how to understand the German health insurance system here. If you are brand new to Germany, here's what you need to know. And if you're not, and you're just here to watch the switch, well, then you can skip to the next chapter. So again, everybody must have health insurance here in Germany. There are two different types of health insurance. We have our public health insurance and our private health insurance. Public health insurance in German is also known as gesetzliche Krankenversicherung, and private health insurance is known as Privatkrankenversicherung or PKV. So public health insurance in Germany is what around 90% of people living in Germany actually go with. Many people don't even have an option to go with private health insurance here in Germany if they don't reach this threshold of how much money they need to be earning annually to get to private insurance. So for example, if you are employed and earning under 73,800 euros annually as of 2025, you are not actually eligible to be part of the private health insurance system. Also, children and spouses without an income are generally covered for free under the spouse who is generating an income. This is called family insurance or Familienversicherung here in Germany. Although there are always some exceptions. For example, if one of the parents of of the children is privately insured, more often than not, the child will also need to be privately insured as well. So who chooses private insurance then? Those employees who earn above this threshold of 73,800 euros as of 2025 are often able to sign up for private health insurance. It also depends on your health record as well. For specific professions, for example, in Germany, they call it Beamter. Regardless of their income, they are able to be privately insured and are often privately insured. If you are a freelancer, you often have the ability to be privately insured, or if you are a high earning employee. So with both systems, you are going to get access to doctors, to specialists, to hospitals. I truly believe that Germany has a very good healthcare system, and public insurance covers a wide range of services, doctor's visits, medication, hospital stays. I had 2 babies on public health insurance here in Germany and cannot complain. While private insurance typically tends to cover a little bit more. There are a few perks, like for example, private rooms in hospitals, if available, treatment by the head physician, shorter waiting times in public clinics, getting access to private clinics, more dental coverage, often alternative treatments might be covered, or bonuses like contact lenses or glasses, some over-the-counter medication, and more extensive physio and massage therapy. So while this all sounds nice, there is still a reason why around 90% of Germany's population is publicly insured. And the scope of services in private health insurance does vary depending on the tariff that you have chose for yourself. So it definitely doesn't always include all of those perks that I just mentioned. And since most newcomers like yourself start with public insurance, much like I did, and since I'm currently switching public health insurance providers, that makes this the perfect opportunity to walk you through this process step by step with me. A few important points to note before we get started: what you pay and how you pay in regards to health insurance here in Germany. So public health insurance contributions are based on your annual income and are capped at this contribution assessment ceiling. For 2025, for example, this cap is 66,150 euros. So how much are you charged monthly then? If it is income-based, you are going to be charged 14.6% of your gross monthly income. And this is a general statistic for everybody in the public health insurance system here in Germany. But if you are employed, your employer is going to be paying half of that 14.6%. In addition, you've also got this Zusatzbeitrag, which I explained is an additional contribution that is set out by every public health insurance provider individually. And this is on top of the 14.6%. So for example, Krankenkasse or TK currently has a Zusatzbeitrag of 2.45%. This is just a benchmark, but to be honest, this is one of the lower rates we have at the moment in Germany. Also one of the reasons why I'm switching. Half of the 14.6% that you will be paying is going to be deducted monthly from your income. You will be able to see that in your pay stubs that you get from your employer every month. Now, private insurance, on the other hand, can be very different. Your employer is still going to pay half of your contributions to your private health insurance company, but the cost of that health insurance depends on your age, your health status, so any pre-existing conditions will skyrocket those contributions for you. Your coverage level, again, depending on which tariff you decide to select, is actually quite cheap when you're younger, but can increase as you age. So now that you understand the why and how you can pay for your health insurance, we are ready to sign ourselves up. Let's go. Since many of you watching this are going to be signing up for health insurance here in Germany for the very first time, I do want you to remember that although we are going to use the exact same application form, that link is included down below for you if you want it, the process is going to be slightly different for you because I have already been previously insured here in Germany. Nonetheless, I will show you just how simple it can be. And if you have any questions about this, they also have their English speaking hotline, which you can call for free and get all of your questions answered. Anybody is allowed to join public insurance here in Germany, but you do have to be here in Germany because you have to meet those legal requirements, which means legally you need to be registered in a city here in Germany. That's one of the first things you're gonna have to do when you first move here. And you need to have a valid residence permit. For any of you watching this video who want to switch, who can switch? Anyone in the public health insurance system. Also, if you've been privately insured before and no longer qualify for private insurance, you might also be able to make that switch, but I would recommend calling their hotline first just to get all of the information there, as it is a bit of a gray area. And again, for those of you wanting to make a switch today like I am, you can do this only if you have been insured with another public provider for at least 12 months, and it's subject to a 2-month notice period. Termination is possible earlier with certain circumstances, like I mentioned, with private health insurance if you fall below the income threshold. So Are you ready? Okay, so we are here together on the homepage. Again, you and I were using the same link regardless of if you're switching today or signing up for the first time. That link is down below, so you can go ahead and do this with me if you would like, if it's easier for you. You can scroll down if you want to see more of your advantages, get any more information. It is all available there. But we are going to scroll up right now and become a member of TK. So our process is going to be a little bit different because I am self-employed, but here under the application form, you can actually select whether you are an employee, a student, or self-employed. Now, I've actually just gone through and done the application for the self-employed. It is very, very basic. I quickly put in my information and they're gonna send me an application via post, but I have received all confirmation in English, my application ID number, and everything was sent immediately to my email. But for this purpose, we're gonna go into the application form for our employees and apply similar to the way that you would when you're getting started. So in which country did you last have your health insurance? Typically, this is going to be a different country. Let's say I was in Canada. This is how I would have started when I first got here to Germany. I have been employed since, or I'm starting on. So if you have a job already as an employee here in Germany, then you can already punch it in. Let's say we're starting on the 15th of June, 2025. And what is the month grossly salary that you receive for your employment in Germany? Got a little bit of information there regarding any bonuses that you might be receiving. And now it's asking if you're a shareholder, are you self-employed? Filling in some basic information. Straße. My whole family thinks it's Strabe. Straße. Sharp S and a soft S. Did you know? Düsseldorf, in Germany. As a part of the process of becoming a new member, I would like to communicate with TK in English via email. This is an important one. Let's say I was born on the 6th of June in 1985. I was not. This is so much easier in English, you guys. Did you have a different surname at birth? Apply for pension payments, pension benefits. Are you exempt from health insurance? Would you like to take out free coverage for a dependent? At the moment, we're gonna say no. Start date of insurance. The earliest I can start is on the 15th when I am officially employed. And you can consent to voluntarily signing up for any updates that come through via TK there. You can also get their TK welcome guide, which I think is super cool. I would definitely recommend going through this, even if you've been here for a long time and are making a switch. And then some referral information. All right. So next, submit your photo for the TK e-health card. This one looks pretty nice. I don't know if you're actually allowed to use this. Your face has to be photographed from the front, can be seen clearly, is bright lighting, background is neutral, don't wear sunglasses, a cap. So it's very similar to a passport photo. Because this is just a test right now, I'm just gonna upload this photo and then you can click consent and go ahead and click send. And that's it. You will then get an email similar to the way I did, stating that they have received that application from you, and any next step process will be shared on your phone. You don't need to wait as long as I did to make the switch. I really wish I had done it sooner. Don't worry, you don't have to go to your old provider. I know it's super awkward to be like, sorry guys, but I'm switching, and have to get all of that information. None of that needs to be done. TK does that whole switching process for you so that you don't even need to contact your old health insurance provider. So now I'm going to jump in and answer some of the questions that I know are going to be flooding in, and that is going a little bit more into detail about why I chose TK, how I figured out how much money I'm actually going to save annually, and why I chose public insurance over private insurance when I do in fact, as self-employed, qualify for private insurance. So why TK? So I did explain briefly at the beginning of the video why I made that switch, but now I want to dive into a few more of their awesome features that really enticed me to make this switch. TK has recently introduced their new AI supported chat service. So not only are they offering service and support in English, but in 6 different languages, so that most of us will be able to get by managing our German health insurance here in Germany. And then of course, if you don't find the answer that you're looking for from this AI supported chat, then they also have their English speaking reps and their English speaking hotline that you can call when you need, and you will get those answers right away. You might also be able to get more personalized information for your specific scenario. Another deeper reason why I want to switch, I know I mentioned the app and how friendly it is for expats because it's run in the English language, but there is so much that they offer packed into this one app. They offer bonus programs so you can get points towards being healthy and actively participating and doing things that keep you healthy, like going to the gym, going for any annual checkups that you have. You can get digital sick notes, which I know is super stressful when you're like lying next to the toilet and you're like, how am I gonna get to the doctor to even get that sick note here in Germany? Because I do have to mention, in Germany they're super flexible and super kind and understanding when you are sick, but they will ask for that sick note. So this makes it super easy. They offer mental health support for anyone who is pregnant or planning on being pregnant. They have this TK Hebammenberatung, which is a midwife support service. So you can actually chat or phone with a midwife here in Germany 7 days a week. This may or may not amaze you, but after living in Germany for 11 years, finding a midwife in Germany has been one of the most difficult processes I have had to go through in Germany, second to getting my kid a spot in the daycare. Oh my goodness. They've got this TK Doc service, which is basically if you're on vacation or you're too sick to get to a doctor's office, you can actually video call or phone a doctor through the app. They've got another app feature called the IMO app. It's a healthy movement exercise app. This partner app uses AI technology to guide you on your path to a healthy, personalized physical plan. And there are many more features, but there is one more that I really wanted to mention, and that is their TK Reisetelefon. These contacts are always good to have in case of an emergency while you're traveling. And because it's geared for internationals and expats, these services are available in English as well. Now let's get down to the cost of things. Why and how am I saving 300 euros if public health insurance costs are even across the board in Germany? Well, as I mentioned, we've got that Zusatzbeitrag or the additional contribution, and TK has a relatively low one. I mentioned that it's 2.45% this year. So if we look into the calculations, for example, let's say that my monthly gross income was 3,000 euros. I'm self-employed, I have a family with 2 children, and because I'm publicly insured, I pay a contribution rate of 14.6%. I am not employed, so I don't have an employer paying that 7.3% with me. So I pay the full 14.6% of my gross monthly salary. So my old insurance provider has currently increased its rates to 3.29%, whereas TK is sitting at 2.45%. We can calculate this, that my 3,000 euro monthly gross income times 14.6% of my monthly contribution ends up being around 438 euros a month. My old insurance provider, I would be paying 98 euros and 70 cents as an additional contribution. With TK, with 2.45%, I would be paying 73.50. So if we take my monthly contribution and add that additional contribution each month, it used to be 536.70, and now it's going to be 511.50, meaning my monthly savings is going to be 25 euros and 20 cents. That's not little. And then times that by 12 months, I would be saving 302 euros and 40 cents. Not bad. And next question before we wrap up is, why did I choose public insurance over private insurance when I did indeed have the option? Financially, guys, it has to make sense. Private insurance can be much cheaper if you are young and healthy. I am still young. I am very healthy. But even for me, being voluntarily publicly insured ends up being a little bit cheaper than private insurance. It's cheaper because I have 2 kids who are registered for free under me. If I was privately insured, I would have to pay for my children's health insurance coverage. And to be honest, GKV or Gesetzliche Krankenversicherung, your public health insurance here in Germany, has a lot of benefits for children and families. And I'm not gonna lie, I honestly find many private health insurance companies not very expat friendly. There's very few that are in English or even willing to speak English. Not to mention, every time you go to a doctor's office and you get a prescription, you have to pay for those prescriptions up front and they reimburse you at a later date. With public health insurance, you just give them their card and you're good. So it may differ for you, and we do have videos going through this on the YouTube channel, comparing the two, figuring out what's best for you. The most important thing to know is that public health insurance in Germany covers all your essential medical needs. Generally speaking, public health insurance is built to be a lot less complex than private health insurance, just making the whole process much easier. So I know that was a long, detailed video, but I hope it really helps all of you. Again, as I mentioned, if you have any questions and you want to ask in English, no problem at all. They do have their English support service that you can reach out to and get all of your questions answered. Also, that link is down below if you do want to sign up for yourself or if you're ready to make the switch. Overall, I just want an affordable, user-friendly insurance that is comfortable interacting with me in the English language. So if you're an expat, student, employee, just tired of dealing with German paperwork, TK might be worth checking out for you too. Vielen lieben Dank und wie immer, bis später.